Greetings, friends and followers. This is Nurses Talking Live with Dale. And of course, it's October, and as I promised you, we were going to talk about breast health, and we'll have some guests joining me. And the first of those guests today is Dr. Majeedat Abdul out of Havana, Cuba. If you are joining us live for the first time, welcome, welcome, welcome. If you're a returning listener, thank you so very much for joining us again. In any case, if you're looking at the live, please let us know where you're watching from. And if you have questions or comments, please put them in the chat and we'll try to reach them at the end of the talk. So, Dr. Abdul is a general physician. She's a freelance health writer. She's a health educator. She's passionate, she says, about teaching and creating awareness around mental health and women's health. And she says that when she's not attending patients or writing about health, she'll most likely be found writing or reciting a poem or bugging her favorite people. So, welcome, 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 Dr. Abdul.
Much for having me. Thank you. I'm really grateful.
My absolute pleasure. I've been so looking forward to having this conversation with you. So let's just jump right in. What inspired you to focus on women's health?
Well, firstly myself, but then mostly every time I had conversations with women, the basics or what I thought was the basics, like periods, period pain, breast health, I'd always recognize there's a huge gap, like a huge knowledge gap. Like, yes, even though we're women, a lot of women don't understand their bodies, don't understand why things happen. So that really put the passion in me that, okay, I since I have this knowledge and I love to teach, by the way, so let me put in that effort to make sure that, okay, we bridge that gap for as much as I can.
Yeah. You know what, I agree with you, and it still kind of sometimes throws me that at this time, evolution, that sometimes I find that women really are very ignorant about their own bodies. So, speaking of breast health, though, since this is what we're focusing on today, why would you say then that ongoing breast awareness, not just screening, is important?
Well, it's important because talking about breast cancer in particular, there are other breast pathologies, but breast cancer in particular remains one of the biggest public health emergencies. It's the last WHO was about the new cases every year, which is not is a very, very serious situation. In Nigeria, for instance, where I is the number one cause of cancer-related deaths. So it is it's very necessary for us to know what breast cancer is. And beyond that is that, okay, not just knowing this is a pathology that when it's caught early, we have higher chances of saving these women as opposed to when it's caught late.
Oh
So for
dear.
instance, in breast cancer stage one, stage zero, you have 90% plus chance of survival. In fact, at stage zero is 100%. Wonderful, good. I'm now looking at it when it's stage four, when the percentage reduces to about 27, 33% chance of survival. So the more women know about breast cancer, the more women know that, okay, this is it. This is a reality of a lot of women. This is something that people need to know about. And the earlier it is known, the faster that physicians can act and the more be safe. That's number one. Number two, coming from the kind of society that I come from is a very conservative society. There's usually a lot of stigma about some conversation. Even mentioning the word breast for some adults could seem like, oh, it's a thing that shouldn't. So the more we talk about this, the more people are okay. So a woman's body is beyond just aesthetics. Beyond these are really important things that need to be discussed. These are things that need to be known, and it would help us really act. So yeah, I think that's basically why we need to do breast awareness.
Yes, we need to do breast awareness. And so you mentioned that there were other conditions, other things that could affect breast health other than breast cancer. Would you tell us some few of them? Tell us some of them.
Few of them, for instance, there's a mastitis, which is common in breastfeeding mothers. For instance, when a woman is breastfeeding, the the nibbling, sometimes there can be injuries, and then from the bacteria that's on the skin, the normal flora of the skin could get in and cause an infection, inflammation to the mastitis. We have fibrinomas, which is commonly known as lumps that people feel. And so those all of these are benign, but then it's important to know them because you can't really tell when it's benign, when it's not cancer, except you actually know them and then it gets tested. For instance, for fibroadenoma, it has to be taken out, biopsies have to be done before this. What more? There's Paget's disease, for instance. There are a couple of them.
Yeah, there are quite a few things, and one of the things is that when we talked about earlier when I asked about breast awareness, is that one of the things that I think people need to be aware of is that they really need to pay attention to their breasts. Pay close attention, what they look like, what they feel like, what the texture is, because breasts, like everything else, change over time. As our bodies change, our breasts change. And it's the only way we're going to recognize changes. So speaking of that, though, I normal is a broad thing, really, and it's not one size fits all. But when we speak of knowing your own breasts and what might be normal for you, what do you think people should be looking at when they look at their breasts? What should they be looking at?
It's from everything. The color, I mean, your normal skin color. There's a skin around the breast and all that. The size. It's normal for one breast to be slightly, I mean, as women, we know that one breast is slightly bigger or smaller than the other. But then you should know what is normal. You should know when this one is becoming bigger than what is usual. That um you should know, if there are any change vessels, if there are any new lesions, and then that's for physically. And then for touch, every breast, like you said, what is normal is diverse. For instance, with much younger women, teenagers in the early 20s, breast tends to be much more tender, much more glandular. That's when it's growing. And then within the 20s, 30s, when women are fertile, it becomes much more, becomes bigger during the reproductive stage, the pregnancy, the that happens. And then later on, it becomes dense after the age of 40. So, but every woman should know how her breast feels like normally. What feel when I touch it, this is how it's like normal. So that when there is a change in that, even no matter how little, know, I don't feel this way normally. So for me to feel this is something that I check out. And that is why it's advisable for every woman for a woman who's menstruating to have a specific day. Most advice, like within the 1 week after her menstrual period, where she picks a specific day where I check it. It could be exactly 1 day after my period, exactly so that every month, and I know within that period how I feel like. Why we choose that day is because within other periods, your breasts are going through different changes, cyclical changes. So they could feel longer during some periods than the others, but that window, that one period is usually like when your breast is at the most, would I say, the most normal physiological structure that it's going to be. And then for women who are not menstruating, they are no longer menstruating, then they could pick one day every month when they check their breast by touching it and feeling okay. Because you really need to know. I mean, I can't explain to you how your breast should feel. Some people
Exactly.
can't explain, but I should know this is what it feels like normally, so that when there is a change, I go check it out.
Yeah, yeah. And also, one of the things you were talking about feeling and touching, seeing what your breast is. When many women, when they do breast self exams, there were many women as I speak to women think that they should be looking for lumps. And yes, they should be looking for lumps, but they should be also looking for other things, actual texture of the skin of the breast. Yeah,
That's true. It's true.
yeah. So you mentioned as people get older, sometimes the breast tissue becomes dense. There's a lot of talk recently about dense breast tissue. What exactly does that mean?
So as I mentioned earlier, as we grow, as changes, even the breast change. So that increased breast density. But I think most of the concerns around that is usually how mammograms, which we're going to talk about, you know, how mammograms find it a little bit more difficult, or how it's a little bit more difficult, not mammograms, how it's a little bit more difficult for us to detect using mammographs if there is any lesion. But then I think an advancement that is making this easier is with the new 3D mammographs that are available, even though I do know still something new because it's not in all centers. Personally, I've not seen one, but
Well,
I think that makes a little bit of a and is a bit of an advancement. I hope that with more times we have much more centers so that the whole fear of not being able to have lesions detected earlier with 2D mammogram.
yeah. And so you said you hadn't seen one. So for the benefit of our audience, and since we're talking transparently, um, clear, clear transparency. I've had one. If you think 2D is painful, 3D is even more so. But you know what? You go and you do it. You do it. Now, there is a thing also about those 3D mammograms. There's a conversation about that because there are people who feel that they, first of all, deliver more radiation, and also that because they are 3D and they squash a little more, that they can injure the breast. What do you think about those? About that?
It's in their misconceptions. They're valid concerns. They are valid concerns, but there's no studies thus far. I mean, medicine keeps on changing, but thus far there is no study to prove that any injury to the breast, the amount of radiation that comes from mammogram is enough to cause, breast cancer or to progress breast cancer. Yes, it is true that radiation around the breast region causes it, but this is higher level of radiation. For instance, women who've had lymphomas, for instance, and have had treatment with radiation therapy, that's a special, but not the level of, and not the radiation level that is required, perhaps not at that level. So yes, it is a genuine concern because I'd probably feel the same way if I wasn't in this field. But right now, there's no studies that proves that any of these increases a person's risk.
And the other thing that they use also when breast tissue is very dense is an ultrasound. Yeah, and what would be the benefits of doing that?
I think it permits better visualization. I would be very sincere to say that when it comes to the ultrasound, there are also use of MRI. I'll be very that but I do know that it is to give better visualization and of course better trust and feeling of safety.
Yeah, exactly. Now, you talked about earlier on. You mentioned that in some societies it is very some societies are very conservative, and don't want to have these kinds of conversations. So culturally, what would you say the cultural or faith-based, even sometimes socioeconomic barriers then that you have encountered where it comes to dealing with people and or educating, because education is one of your things, educating people about breast health?
Okay, I would say culture. I don't know how it's like in the States, but like in my country, we still have much more obstetrician gynecologists compared to female. So we have women who would prefer to not go have themselves checked if the doctor could be a male. So there's that aspect there. And then also talking to cultural belief, there's this cultural belief we have traditional medicine, which in its own sphere is important, but then sometimes we have cases where women begin to detect changes, stage one, stage two, that they should have, but then no, they go traditionally, they're taking herbs, is that things that do not actually solve the situation until it has gone to the final stages, the stage four, where it's obvious that no, they're not working before they come to the hospital. So that's a huge problem that we have. Socioeconomic is some people actually do know that they should go to the hospital. Some people do want to go to the hospital, but when they think about it, like, okay, when I do go to the hospital, how much do I have? Can I actually, can I actually pay for the bill? So they'll try to just, keep it in until they can't. And these are
Yeah.
some of the challenges.
Yeah, and especially socioeconomically, I mean, even if you have um, the wherewithal at this time to take care of this particular test, what happens if the test proves to be positive and you need something else?
That's also another problem. In
Yeah,
fact, recently I had a colleague who is presently in treatment for breast cancer. She needed, the whole funding, the whole donation, things like that. And this is a professional, this is a career woman who actually did have some money on her own, but then she still needed the funding. So imagine a woman from a very, from the lower class who
yeah,
can't even, it's a big problem. It's a
it's a
huge
big
challenge
problem.
in that.
Yeah. So other than where we did talk about breast self-examination, but other than that, what are some of the things that women can do to pay attention to their breast health?
So, like, I'd like to, like I was taught in school, they'd always say that everything for medicine always starts with lifestyle before we talk about everything. So the first is lifestyle. A lot of things, although may seem just as aesthetics, beyond that, they really impact our health in ways that we don't know. For instance, one of it is there is no diet that is proven to prevent breast cancer, but there are certain diets that help, build your immunity, that help you, um, reduce inflammation. I'm talking about plant-based diets, the Mediterranean diet, all of those diets, and they also help you control your weight because the weight now, obesity has been found to increase the risk of having breast cancer. So, you know, avoiding being overweight, that comes down to exercise, that also goes back to dieting. Another one is it has been shown that alcohol increases, though some studies say not as much, some say as much, but it does increase the risk of developing breast cancer. So that is something that should be dropped. Smoking is it's tobacco smoke. Smoking in general has been known to be a major risk factor for breast cancer. For smoking, a woman who smokes, stopping smoking is a must if you do care about your breast health. Um, what more can I mention? And so that's for lifestyle. Let me see if I can think of any other thing. Yeah, that's basically it for lifestyle. Then now coming to risk factors. Now, even though we talk about breast cancer in general, we talk about taking care of your breast health in general, there are women who have higher risk factors of breast cancer than others. So of course they have to be much more vigilant. Even their scheduling for their mammograms will be different, which we're going to talk about mammography. So, like a woman who has a risk factor, like a mother who's had breast cancer, a sister, an auntie, a first degree relative who has had breast cancer, much more, much more careful, has to
Hmm.
pay more to changes in her breast as opposed to other women. I mean, we all have to, but these women have to be specific, careful. Then I spoke about obesity, women who smoke, women who drink. So this is on risk factors. No, how to pay attention. This in my country is not really so common, but then there are women who actually try to know if they have the BRCA1 or 2 gene, especially if they had a mother or a sister who have had, breast cancer. They try to do so, and some of them even end up having mastectomies to prevent it from occurring. But then that's a little bit more further. That's not common for all of us. And then the breast self-examination, which is what we've spoken about, doing that every month. And finally, mammography. So having mammographs from the age of 40, there are different guidelines depending on the school of thought. The American Society has their different guidelines, but in general, from the age of 40, from 40 to 45, some even say up to 50, like I said, there are different schools of thought, you should be having your mammographs once in every years. And then beyond the age of 50, one every year. And then I think beyond the age of 60, you should have it every other year. But then the general rule is that from the age of 40, mammograph are part of, the way you have one appointment a year, you should have that. And for women, now coming back to a risk factor, because I was having a conversation with a friend the other day, her mother died from breast cancer. And so for women like this, 10 years, especially if the mother had breast cancer at a very young, her mother had breast cancer in the 40s. So the general rule is that taking the mother's age minus in 10 years from when the mother had breast cancer, that woman is supposed to start having mammograms from that age. So, say a lady's mother died from or had breast cancer at the age of 42. So, by the time she's 42 minus 10, 32.
Mhm.
From 30, woman should start having mammograms. Yes, that's not the general guidelines for everybody, but because this particular woman has higher risk factors than others, she now has to start having mammograms early. And in general, that's it.
Yeah. And that is something that I think we need to stress with women is that you really need to be in touch with your provider and have clear history about what your risks are so that it can be determined when it's appropriate for you to start and how often it's appropriate for you, because of course it's different for everyone, as you said. I have another question. We have been talking about this a lot about women, but men get breast cancer too. So, and I know that the incidence is much less in men, but it occurs. It can occur. So, what could a man look for? What would tell a man, listen, I need to pay attention, something is wrong here?
I'm going to say that even though I know breast cancer occurs in men, I am guilty of never. It never even. I don't even study. Yes, it occurs in men. Oh, I don't. I can't say. I honestly.
Yeah, but men have breast tissue too, and those things. But uh, some of the things that men see, though, for example, um, uh, gynecomastia. Gynecomastia is breast, enlarged breast tissue in men, very often caused by hormonal imbalance. And hormonal imbalance again is something that leads into breast cancer, and breast impaired breast health, and those are things that they need to look for as well. So, men, if you feel something's not right, if it doesn't look right, if it doesn't feel right, and it walks like a duck, it is a duck. If there is, things that we see, that we talk about with women, actually, probably the same things with men. If you see a change in nipple structure, if you see a discharge from nipples, if you get a rash or an itch, or sometimes an itch is a big one, a constant.
Age in a
Yeah,
certain area.
yeah. Sometimes an itch is a big one. So before we go, Dr. Abdul, if you could leave women with three things that you would like them to pay attention to, what would they be?
Oh, number one, know your breasts. That's that's the hallmark of all of this. Knowing your breast. What does it look like? What does it feel like? Your skin around your breast. Knowing your breast so that if there's any change, you know that yes, something is wrong. That is number one. Number two, never be shy or ashamed, hesitant about going to the doctor. It's better for you to go to the doctor and they're like, oh, it's nothing, than for you to sit at home and think it's not, it's actually something. So that is number two. Go to the hospital. You have insurance, you're paying for it. It's your right to go to the hospital. Yes, it's better for the doctor to be like, oh, you're just worrying about nothing, but let's actually be something. Because this is a very personal case. But she was having the and she didn't go to the hospital. It kept progressing. We lost her last year. It's still something that's hurtful to me. So it's best you go to the clear than for you to assume it's clear. So that's for number two. And number three, life. Um, genetics. I read a paper today that said of cancers, genetics usually just plays 10 role of different depending on the cancer, but 10% to 20% is genetic. Most of it is environmental factors. What we eat. Are we are we active? Exercise is beyond aesthetics. Exercise is beyond whether we look good, we don't look good. That is. I mean, that's important, but it's compared to other things, is the least important thing. Alcohol, yes, it might feel good, but no, smoking. Yeah. So number, know your breasts. Know your breast. What is normal? So no, because if you don't know what is normal, you cannot not normal. Know what is normal. Number two,
Yeah,
go bug that physician, disturb them. Check this, check this. Make sure at least let them clear you that it's normal. Number three, please take care of your lifestyle, especially as we tend to take care of everybody else except ourselves. Please take care of yourself. Those are the three
yeah,
things.
yeah. Thank you for those. And I'm glad you mentioned genetics because that brings up a question that I meant to ask you because, there are a lot of people who think that if they have no family history of breast cancer, then they're in the clear. And that is so false.
False. That's very, very false. In fact, all the
That
cases,
is,
like the people I know personally, I don't think any of them had any family history. They were like the first. So that's very.
yeah, yeah, yeah. Let's see if there's anything in the chat that we need to address. Hold on. Okay. So Divine Enrizi out of Nigeria says, I'm happy to be here. And he says, wow, I didn't know men could get breast cancer. He goes on, you need to provide contact your provider to know your history. He says, most women are afraid of going to the hospital for this. Okay. I think Divine is the only person who left us a comment. Well, we're happy you're here also, Divine. So thank you so very much for joining us. And friends and followers, thank you for being here. We will be doing another live on Thursday, and at that time we will have Catherine Petty, who is a nutritionist, and we will be talking about nutrition for breast health. So Dr. Abdul, thank you once again for joining us. Thank you so much for your expertise and for your knowledge and for being so willing to share it. Thank you.
Very, very much. I'm really grateful to be here. Thank you. Have a
My
lovely
pleasure.
day.
You too.